Hi, everyone. MPP Jeremy Roberts here, and I'm delighted to be joined today by Dr. Fahad Razak, who is an assistant professor at St. Michael's Hospital in Toronto, as well as at the University of Toronto's Institute of Health Policy. Dr. Razak is an internist and epidemiologist focused on improving the care of hospitalized medical patients. Dr. Razak, thank you so much for joining us.
Great to be with you.
So we're going to be tackling another topic on this week's edition of the COVID facts videos that we've been doing. And the topic this week that we're going to cover is comparisons between COVID-19 and the common flu. And this is something that we hear about quite often in our office, Dr. Razak, with folks asking about comparisons between these. So perhaps my first question to you would be, is COVID-19 worse than the common flu? Because this is something that we get asked about quite often.
Yeah, it's a great question. So one of the most important comparisons for COVID-19 is the flu because it's a viral illness and it tends to make things like breathing and function more difficult. Before we had the COVID pandemic, people really weren't sure. Other coronaviruses could be as severe as the flu. Some are not as severe as the flu, but we have really good Canadian data now on this. So we've just published the largest study to look in Canada at hospitalizations for COVID-19. And we compared it directly to a Canadian sample of influenza admissions. And the differences are dramatic. So people with the flu, they do get hospitalized, but people with COVID, they're 50% more likely to require the intensive care unit. On average, they end up staying in hospital 50% longer than patients with influenza. And they have remarkably 3.5 times the mortality rate as patients with influenza once they're hospitalized. So this is clearly a much more severe disease than influenza.
Well, and to touch on that, we hear sometimes with folks saying that the death rate for COVID-19 is no more than the common flu. Could you touch a little bit on the rates of mortality and the rates that we've seen in terms of COVID-19 versus influenza?
Absolutely. So influenza fluctuates year to year in both its severity and how common it is. In our study, we looked at the most severe waves of influenza. And so we didn't take influenza this year, which has been relatively minor or nearly non-existent. We looked at prior waves of influenza that have gone through the hospital system, and we compared those directly to this year's COVID pandemic. And what we found is that the mortality rate was 3.5 times higher for COVID compared to a typical bad influenza year. That's a huge difference. There's very few illnesses we see in hospital that are that much more severe than conditions like influenza.
And you mentioned that this year we've seen lower rates of influenza. Uh, is there any research suggesting as to why that is?
Yeah, it's been one of the most fascinating things that has happened during this COVID pandemic. In the fall, many of us in the scientific community, frontline physicians, we were really worried about potentially facing a dual pandemic. The influenza season that tends to hit in Canada every year, late in the winter, starting around November, December, carrying over into early spring, plus COVID. But remarkably, we saw almost no influenza end up coming into hospital. For those of us who study this area, this is by far the lowest rates of influenza we have seen historically when we look back at data over the last many years. There's a lot of theories about why. It could be that the physical distancing, the hand washing, the mask wearing, all of the things we're doing to prevent COVID exposure are remarkably effective against influenza. Clearly, there's also other factors. There's a lockdown in general. So not only the precautions we take physically, but people are just encountering each other less frequently now because of the lockdowns. The third area that's probably affecting this also is international travel. So influenza, it's carried in by international travelers. It's not that we don't have international travelers now, it's just the frequency of travel has decreased so much that there's less of that flow of influenza coming in. So a lot of factors, but the end result, essentially no influenza is what we're seeing. I can give you an example at St. Michael's. Normally we start our testing for influenza late in the fall. We carry it on right into early spring. We've actually stopped testing for it because every time we send the test, it comes back negative.
Wow, fascinating. And obviously, when we talk about the common flu, it's something that impacts everybody. Whereas with COVID, we seem to focus very, very precisely on the impact on seniors. Is that something you could shed some light on? Is COVID-19 really just impacting seniors?
Yeah, it's another great question, and I think it's an important point about a point of misinformation. So clearly, this is a disease that is most severe in the elderly, especially the elderly in the long-term care sector. But it is also a severe disease in younger individuals. So in our study, we also looked at individuals younger than age 50 and individuals who had really no major medical history. So under the age of 50, healthy adults, no major medical history. When they were sick enough with COVID exposure to require hospitalization, this is still a very severe disease. So if you take that group of people under the age of 50, if they're admitted into hospital, 1 in 20 of those individuals will die from COVID. 1 in 3 of those individuals will be so sick that they require intensive care unit admissions. And 1 in 10 of those individuals are so sick that even after we discharge them from hospital, they end up getting readmitted because they're just not able to sustain themselves outside of hospital. So very sick, very severe illness in the elderly. But if you are young and you're sick enough to require hospitalization, this is really a bad disease for you as well.
Fascinating. Well, thank you so much for shedding some light on some of these topics. I think this will be really valuable information for a lot of my constituents, and really appreciate all the hard work that you and your team are doing tracking the data on this COVID-19 pandemic.
Our pleasure. Great to be with you, and stay safe.
Thank you.